Well, I think we're starting with a number of slightly disjointed systems in relation to the elements that point towards patients, and actually the elements that actually sit within practices in how they communicate both with hospitals, across organisations, and therefore actually it's actually that I think we've got most or many of the moving parts in place. It's connecting the dots now and actually ensuring that represents a seamless patient journey, but also unleashing some of the efficiencies that are there to be had for practices in how they cope with the increasing pressures in the system. So when I started in December, I was keen to bring some insight into what general practice is currently feeling like at the front line, into the decision making of how things were being influenced from the NHS England perspective. I think we wanted to try and create a stronger connection with the profession, with its representative bodies, and with jobbing GPs. And I think actually develop a vision, a joint vision of the sorts of changes and direction we wanted general practice to take so that it could do the best job possible for patients, but actually also bring about a manageable working day for doctors and nurses and other practice staff, and develop a size and scale of teams within practices and across practices that could go much further in the range and breadth of offer for patients, and also bring in some efficiency gains for practices to reduce some of that workload. Well, it's a really good shop window to understand what developments are available in the system and actually open our eyes, I think, to the art of the possible, and actually how it might accelerate the sorts of changes that we need to see if we're to get to the version of general practice that is best for patient care, best for how clinicians are offering a service and optimising their potential, and actually the best value for money for the taxpayer.